Hi friends, have you heard about Uhtov's phenomena and Hermit sign and for which disease condition these terms are associated? So we will be explaining about such important terms and some important, very important informations in this video. And once again, I am welcoming you all back to our channel, the Nurse channel. And as you all know that we have started our preparation for the upcoming JIPMER nursing officer examination and also for the PGIMER in the Sangrur. Okay, so this video also contains 20 very important, very informative questions, which includes 5 GK questions also. And as I told in the beginning and as I used to tell in every videos, the explanations what I have given for each questions is very important. And I can say that more than questions, the explanations are very important. So I request everyone who are watching this video to watch the video till the end without skipping so that you will get a bunch of information. So without losing time, we will move on to the video. Before that, whoever not yet subscribed our channel, kindly subscribe and support us, and kindly share about this platform to your nursing friends. So straight away moving on to the video. So moving on to the very first question in the series. So the question is, which diet got highest priority for a girl with dysmenorrhea? So the question is, which diet got highest priority for a girl with dysmenorrhea? So the options for you are option number A, magnesium, option number B, calcium and vitamin D3, option number C, vegetables and fiber, and option number D, iron. So the question is, which diet is good for relieving pain in dysmenorrhea? So what is the answer? So the answer for this question is option number A, that is magnesium. Magnesium rich diet can be given for a patient suffering from dysmenorrhea. So if we are taking daily, this magnesium may prevent the dysmenorrhea in some people. How it works means it is working by relaxing the smooth muscles of the uterus and by reducing the prostaglandins that cause the periods pain. Okay, so the action is on the uterine muscles by relaxing them, by producing the prostaglandins and thereby reducing the pain of dysmenorrhea. Okay, so that magnesium rich diet is good for dysmenorrhea. So moving on to the next question in the series, second question. So the question is, for chronic idiopathic intracranial hypertension, which among the following diuretics is used? So the question you should read very carefully. Here the key points are chronic idiopathic intracranial hypertension, not for all increased ICPs. So for chronic idiopathic intracranial hypertension, which among the following diuretics are used? So the options are, first one is mannitol, option number B, furosemide, option number C, acetazolamide, and option number D, hydrochloride. So read the question carefully and answer the question. There are chances that you can make mistake in this question. So the answer for this question is not mannitol. The answer is option number C, that is acetazolamide. So why no mannitol, that I will be explaining in the explanation. So first of all, we will see about acetazolamide. So what is acetazolamide? So for long-term or chronic forms of raised ICP, okay, that long-term or chronic forms, especially the idiopathic cranial hypertension, a specific type of diuretic medicine called acetazolamide, otherwise known as the Diamox, it is used. Okay, so acetazolamide, it is a medication which is used to treat the glaucoma, epilepsy, altitude sickness, periodic paralysis, idiopathic ICP, and urine alkalization and heart failure. Okay, so these are the other conditions where acetazolamide is used. Okay, so this is also a diuretic. So I'll tell you why mannitol is not used in chronic hypertension, chronic intracranial hypertension. So frequent doses of mannitol, it can cause them to leach across the blood-brain barrier and it can worsen the cerebral edema. Okay, how means there is a term named rebound edema. So when we are administering mannitol also, you should administer it fast. It should not be given very slowly because it itself can create inflammation and can worsen the cerebral edema. Okay, so this mannitol which has leached into the brain can draw the water instead of out of the brain. Okay, so it can result in the rebound edema. So for chronic idiopathic intracranial hypertension and all, we should not use mannitol. Okay, acetazolamide is the diuretic of choice, or Diamox. Okay, so I think that question is clear for you. We will move on to the next question, that is the third question. The question is, which lung sound is expected primarily in patients with heart failure? So which lung sound can be heard in patients with heart failure? So that is a question. So the options are option number A, rails, Option number B, rhonchi. Option number C, wheeze, and option number D, stridor. So among these, which lung sound can be heard in heart failure? It's a very important question. So the answer for this question is option number A, that is rails. So first of all, we will see what is a rail. So rails heard over the lung bases are characteristics of the heart failure. So here another important term is there. So where we can hear the lung, these rails during heart failure, that is in the lung bases. Okay. So that is of at least moderate severity. And when the pulmonary edema increases with acute pulmonary edema, rails are frequently accompanied by wheezing and expectoration of frothy blood-tinged sputum. Okay, so in the initial phases of the heart failure, in moderate severity, we can see the rails at the base of the lung. Then with acute pulmonary edema, these rails are frequently accompanied by wheezing and expectoration of frothy blood-tinged sputum. Okay, so we will see the other options also. So what is a rhonchi? See, these rhonchi are continuous low-pitched rattling sound that often resembles snoring. Okay, so it resembles snoring. And why it is occurring? Obstruction or secretions in the larger airways are frequent causes of the rhonchi. Okay, so obstruction or secretions in the larger airways. So they can be heard in patients with COPD, bronchiectasis, pneumonia, chronic bronchitis, or cystic fibrosis. Okay, so these are the conditions where rhonchi can be heard. Okay, so it is in the large airways, obstruction in the large airways, that is the cause. Okay, so the other option was regarding the wheeze. So what is a wheeze? Inflammation and narrowing of the airway in any location from your throat into your lungs can result in the wheezing. So if there is an inflammation or narrowing in anywhere in the respiratory tract, we can hear the wheezing. So the most common causes of recurrent wheezing are asthma, COPD, which both causes the narrowing and spasm in the small airways of the lungs. Okay, there will be bronchospasm and also narrowing will be there, which can result in the development of wheeze. Okay, COPD and obstructive pulmonary disease and the asthma. Okay, so now we will see the last option. So the option is regarding the stridor. So what is a stridor? So stridor, we know that it is a high-pitched extrathoracic breath sound resulting from turbulent airflow in the larynx or lower in the bronchial tree. Okay, so stridor means it is a high-pitched extrathoracic breath sound resulting from the turbulent airflow in the larynx or in the lower bronchial tree, and it may be indicative of serious air obstruction from severe conditions such as epiglottitis, foreign body which is lodged in the airway, or a laryngeal tumor. Okay, so larynx or in the lower bronchial tree, that is important, and it is a high pitched extrathoracic breath sound. Okay, so these are the important key points regarding the stridor. And the final option was regarding the stridor. Now we will move on to the fourth question, that is a GK, and the question is, how many states of India share its border with Bhutan? Okay, so with Bhutan, how many states of India sharing the border? Okay, so the options are option number A, 3 states, option number B, 2 states, option number C, 4 states, and option number D, 5 states. So how many states are sharing its border with Bhutan? So the answer for this question is option number C, that is the 4 states. So which are those states? That is Arunachal Pradesh, Assam, West Bengal, and Sikkim. Okay, these are the states which share its border with Bhutan. Okay, so moving on to the fifth question in our series. The fifth question is in the screen right now, and the question is, which among the following are typical side effects of epinephrine? Okay, so which among the following are the typical side effects of epinephrine or adrenaline? So the options for you are option number A, bradycardia and hypotension, option number B, bradycardia and hypertension, option number C, tachycardia and hypotension, and option number D, tachycardia and hypertension. So just think about why, in what all situations we are giving the epinephrine, and what can happen if we are giving the epinephrine, and what are the side effects. So it's an easy question. So the answer for this question is option number D, that is tachycardia and hypertension. Okay, tachycardia and hypertension. So we will have a brief explanation about this question. So epinephrine, as we all know, it is otherwise known as the adrenaline. It is a medication, so it's a medication and hormone, okay, that you know. So as a medication, it is used to treat several conditions like anaphylaxis, cardiac arrest, asthma, and superficial bleeding. Okay, so the question we have asked about the side effects of epinephrine, and the more common side effects include tachycardia, hypertension, headache, anxiety, apprehension, palpitation, diaphoresis, nausea, vomiting, weakness and tremors. These are the other common side effects. So we have asked about the tachycardia and hypertension. Okay, so don't be confused. This is the answer for the question I have asked. So moving on to the next question in our series, the sixth question. So the question is, a newly admitted patient's medication orders include Donepezil hydrochloride. So the nurse knows that this medication is prescribed for what? So the question is, Donepezil is prescribed for which disease condition? Okay, and the options for you are option number A, bipolar disorder, option number B, schizophrenia, option number C, Alzheimer's disease, and option number D, major depression. So among these, for which disease Donepezil is used? Medicine named Donepezil. So the answer for this question is option number C, that is Alzheimer's disease. Okay, so we will see what is a Donepezil and how it acts on the Alzheimer's disease. Okay, so we know that Donepezil, it is a medication which is used to treat dementia of Alzheimer's type. Okay, and Alzheimer's disease, first of all, we will see just a small pathology of Alzheimer's disease. Then only we can understand how this Donepezil will act. So Alzheimer's disease involves a substantial loss of the elements of the cholinergic system, and it is generally accepted that the symptoms of Alzheimer's disease are related to this cholinergic deficit. Okay, so there will be cholinergic deficit, particularly in the cerebral cortex and other areas of the brain. So this is the key term, that is the cholinergic deficit. So how this Donepezil will revert this means, this Donepezil binds and reversibly inactivates the cholinesterases, thus inhibiting the hydrolysis of acetylcholine, and this increases the acetylcholine concentration at cholinergic synapses. So as I explained, cholinergic deficit is the reason for Alzheimer's disease, and this Donepezil will increase the concentration of acetylcholine in the cholinergic synapses. Okay, so that is the mechanism of Donepezil. So I think that question was very informative for you. Now we will move on to the next question in the series, and the question is seventh question. A patient admitted to the hospital with myocardial infarction develops severe pulmonary edema. So which of the following symptoms should the nurse expect the patient to exhibit? So the question is, a patient admitted to the hospital with myocardial infarction develops severe pulmonary edema. So what are the symptoms should the nurse expect in the patient to exhibit? So the options are option number A, slow deep respiration, option number B, stridor, option number C, bradycardia, and option number D, air hunger. So I think you can omit one option directly, because already regarding the stridor already I have explained in this session itself. So what is the answer for this question? Among these options, which symptoms you can expect in a patient with pulmonary edema, severe pulmonary edema? So the answer is, obviously answer is option number D, that is air hunger. Okay, so we will see what is the air hunger. So patients with pulmonary edema experience air hunger, anxiety and agitation. Okay, so the respiration is fast and shallow. So in the option I have given slow respiration, but the respiration in the pulmonary edema will be fast and shallow, and the heart rate increases. There won't be bradycardia, there will be tachycardia. Okay, and stridor is a noisy breathing, already I have explained, caused by the laryngeal swelling or the spasm, and it is not associated with the pulmonary edema. And the conditions where stridor can happen already I have explained. Okay, so that's all regarding that question. I think that also was very informative. So the options are very important. Okay, you have to think about these options before answering the question. Okay, so moving on to the eighth question. The question is, women who have already had an NTD affected pregnancy and are planning to become pregnant again should consume how much folic acid? So the question is slightly confusing. So what is the NTD? That is a neural tube defect. Okay, so the question is that already the lady is affected by a NTD pregnancy, like her first baby is affected with NTD, and she is planning for a second pregnancy. In this situation, how much amount of folic acid is advisable? Okay, how much folic acid you have to give? So that is the question, and the options for you are option number A, 400 microgram, option number B, 200 microgram, option number C, 4000 microgram, and option number D, 2000 microgram. So already NTD affected pregnant lady planning to get conceived. It's not yet pregnant, she is planning. So then how much folic acid she should consume? So the answer is option number C, that is 4000 microgram of folic acid she should consume. Okay, so we have a small explanation regarding this question. So as per the CDC, the current recommendations are that these women consume 4000 microgram of folic acid each day beginning 1 month before becoming pregnant and through the first 3 months of the pregnancy. Okay, so throughout the first trimester and before getting pregnant, before 1 month getting pregnant, she should start with 4000 microgram of folic acid. And another important point, women who have had an NTD affected pregnancy should consume 400 microgram of folic acid each day even when not planning to become pregnant. Okay, so already if a lady is having an NTD affected pregnancy and if she is not planning pregnancy also, she should consume a minimum of 400 microgram of folic acid each day. Okay, so these are two very important points that you have to remember. And for a normal pregnancy, how much folic acid to be consumed, that you can reference. Okay, so now we will move on to the next question in our series. That is it is from a GK geography, and the question is, what do you call land with water on 3 sides? So the question is, what do you call a land with water on 3 sides? So the options are option number A, island, option number B, peninsula, option number C, isthmus, and option number D, inland. So what is the answer? Island, peninsula, isthmus, inland. Inland. So the answer is option number B, that is peninsula. So peninsula means the land, it is covered by 3 sides. Island means it is completely covered by water. Then isthmus, I think the 2 sides of the 2 sides are covered by water. Okay. So moving on to the 10th question in our series, and the question is, the nurse should encourage the client who is on tab lithium to make sure his diet has adequate dash. So the question is, the nurse should encourage the client who is on tab lithium to make sure his diet has adequate amount of dash. So the options are option number A, sodium, option number B, protein, option number C, potassium, and option number D, iron. So lithium, so think about lithium toxicity. For preventing lithium toxicity, which electrolyte is required? So those things you can think about and answer this question, and the answer for this question is option number A, that is sodium. So why sodium? So sodium restriction, if the diet is less in sodium or if there is a restriction for the sodium, it enhances the renal tubular reabsorption of lithium. Okay, it increases the renal tubular reabsorption of lithium and thus leading to potentially toxic serum levels of lithium. Okay, so that can lead to potentially toxic serum levels of lithium. So that's why we should not restrict sodium, and we have to provide adequate amount of sodium for the patient taking tab lithium. Okay, so from the other things, I think you have to think about what is the normal levels of therapeutic levels of lithium, toxic levels of lithium, all those things you can refer and see. Now we will move on to the 11th question in our series, and the question is, so dash causes a foul smelling vaginal discharge, genital itching, and painful urination in women. Okay, so this question is slightly confusing. So the question is, there will be foul smelling vaginal discharge, genital itching, and painful urination. Okay, these are the key terms. So the options for you are option number A, trichomoniasis, option number B, syphilis, option number C, genital warts, and option number D, bacterial vaginosis. So almost all the options what I have given here are sexually transmitted diseases, and there are other diseases also where we can see the vaginal discharge, then a genital itching, and painful urination. Okay, so among these options, which is having these symptoms? That is a question for you. Trichomoniasis, syphilis, genital warts, bacterial vaginosis. So the answer for this question is option number A, that is trichomoniasis. Okay, in trichomoniasis, painful urination will be there. Okay, so we will see the trichomoniasis. It is an infectious disease which is caused by the parasite Trichomonas vaginalis, and the symptoms can include itching in the genital area, the bad or the foul smelling thin vaginal discharges, then burning with urination, and pain with the sex. Okay, so these are the symptoms of trichomoniasis, and this is resembling like gonorrhea also. Gonorrhea also, there will be painful maturation will be there. Okay, so there are some other conditions also that you can see. So the other options we will see what are the characteristics features. So in the syphilis, the patients will be having painless. So here the Lesions are painless, open sore on the mouth, genital sore in the anus, and the sore occurs at the location where syphilis entered the body. Okay, so the sore can be painless, making them difficult to find in the vagina or rectum. Okay, so these are painless sores. That is an important key term in syphilis. And the next question is, so the next option was regarding the genital warts. So in the genital warts, what is the characteristics of the lesion is, it's a flesh colored or gray growths around the vagina, anus or the upper thighs. Okay, flesh colored, and it is cauliflower like growths. Okay, and these growths may be internal, itching or bleeding from the vagina or anus also can happen, and there will be in the changes to the flow of urine. There will not be any pain while urinating, there will be changes in the flow of urine will be there. Okay, so these are the characteristics of genital warts. So the key terms are flesh colored, gray growth, cauliflower like growth, internal growth, itching, and changes in the flow of urine. That is genital warts. And last option was regarding the bacterial vaginosis, and it may cause a fishy odor. Okay, there will be fishy odor and vaginal irritation will be there, and many times this will be asymptomatic, and if the symptoms are there, the symptoms are like this: fishy odor and vaginal irritation will be there. Okay, others may not have any symptoms. Okay, that's regarding bacterial vaginosis. Okay, so I repeat, not only trichomoniasis, the other some sexually transmitted diseases like gonorrhea also have painful micturition. So the question here I asked was regarding the options what I have given. From that option you have to choose the answer. Okay, so we will move on to the next question, that is the 12th question in our series. So this is regarding the mastectomy, and the question is, the entire breast tissue is removed but axillary contents are undisturbed in which type of mastectomy? So the question is here, the entire breast tissue is removed and keeping axillary contents. Okay, axillary contents are not disturbed. So this is which type of mastectomy? That is a question for you, and the options are option number A, radical mastectomy; option number B, modified radical mastectomy; option number C, total mastectomy; and option number D, extended radical mastectomy. So you can't do a guesswork in this question, because you should learn and answer this question, because you should understand what each mastectomy is. So the answer for the question I have asked here is option number C, that is total mastectomy. So we will have a brief description about these four types of mastectomies. So first one is the simple mastectomy, otherwise known as the total mastectomy. So for confusing you, I have kept that total mastectomy. If it is a simple mastectomy, you could have answered that question. Okay, so in simple mastectomy, the entire breast tissue is removed, but the axillary contents are undisturbed. Okay, sometimes the sentinel lymph nodes. So what do you mean by sentinel lymph node? Sentinel lymph node means the first axillary lymph node that the metastasizing cancer cells would be expected to drain into. Okay, so sometimes the sentinel lymph nodes also sometimes will be removed. Okay, usually in simple mastectomy, the entire breast tissue will be removed, but axillary contents are not disturbed like lymph nodes. But sometimes the sentinel lymph nodes that can be removed. Okay, so that is simple mastectomy. So the next option was the modified radical mastectomy. Okay, so what is a modified radical mastectomy? So here the entire breast tissue is removed along with the axillary contents like fatty tissues, lymph nodes, etc. Okay, so this is modified radical mastectomy. So we will move on to the next option, that is a radical mastectomy. So what is a radical mastectomy? Otherwise known as the Halsted mastectomy, and this procedure involves removing the entire breast, the axillary lymph nodes, and the pectoralis major and minor muscles behind the breast. Okay, so here the muscles are also getting removed. So breast tissues, axillary lymph nodes, and pectoralis major and minor muscles which are situated behind the breast are removed in radical mastectomy. Okay, so don't be confused between radical mastectomy and modified radical mastectomy. Okay, so then what is extended radical mastectomy? So extended radical mastectomy means there will be radical mastectomy will be done along with intrapleural en bloc resection of the internal mammary lymph node by internal splitting. Okay, so this is a by the sternal splitting. Okay, so that is a radical extended radical mastectomy. So a radical mastectomy with intrapleural en bloc resection of the internal mammary lymph nodes by the sternal splitting. Okay, so this is known as the extended radical mastectomy. So I think that is question is clear for you. So you are getting a bunch of information from this question. So Moving on to the 13th question in our series. So the question is from the GK, and the question is, which was the first English language newspaper published on Indian subcontinent? So first English language newspaper published on the Indian subcontinent, and the options are, first one is the Hindustan Times, second option is the Pioneer, third option is the Hickey's Bengal Gazette, and the last option is the Daily News and Analysis. So what is the answer? First English language newspaper in India. So the option is correct option is option number C, that is the Hickey's Bengal Gazette. Okay, that was the first English language newspaper published. Okay, and it was founded in Calcutta. Calcutta that time was the capital of the British India, and it was founded by the Irishman James Augustus Hickey in 1779. Okay, so we'll move on to the next question in the series, that is the 14th question, and the question is, acute chest syndrome is associated with which among the following diseases? Okay, acute chest syndrome. So the options are option number A, sickle cell anemia, option number B, megaloblastic anemia, option number C, hemophilia, and option number D, myelofibrosis. So where we can see acute chest syndrome. So the answer is option number A, that is sickle cell anemia. So what we have to find out, what is an acute chest syndrome. So you know that there are some crises associated with the sickle cell disease. That is one among that is a vaso-occlusive crisis. There are so many crises out there that you can refer later, that everything is very, very important. So here I will be explaining about a vaso-occlusive crisis named the acute chest syndrome. It is the vaso-occlusive crisis of the pulmonary vasculature commonly seen in people with sickle cell anemia. So there will be pulmonary vasculature occlusion will be there, and this condition commonly manifests with a new opacification of the lungs on the chest X-ray associated with one or more symptoms, which includes fever, cough, excruciating pain, sputum production, shortness of breath, or low oxygen levels. Okay, I think that is clear for you. So in the X-ray we can see a new opacification along with the other symptoms like excruciating pain, fever, cough, sputum production, shortness of breath, and low oxygen levels because of the occlusion of the pulmonary vasculature, which can be seen in the sickle cell anemia, termed as the acute chest syndrome. Okay, I think that is clear for you. So just read about the other crisis, okay, of the this one, sickle cell anemia. Now we will move on to the 15th question in our series, and the question is, while reviewing the stress management techniques with a patient diagnosed with multiple sclerosis, what would the nurse identify as most appropriate? Okay, so this is an application level question. While reviewing stress management techniques for a patient diagnosed with multiple sclerosis, what would the nurse identify as most appropriate? Okay, most appropriate. So the options are option number A, relaxing in a warm bubble bath, option number B, yoga in a cool room, option number C, sun bathing, and option number D, cross country running. So which stress management technique you will use for a patient diagnosed with multiple sclerosis? Which is most appropriate for that patient? Most appropriate, that is a key point. Multiple sclerosis. So just think about the precipitating factors of multiple sclerosis and you can answer this question very easily. So always option number A, that is relaxing in a warm bubble bath. Okay, so here comes the two terms what I have asked you in the introduction of this video, that is the Uchtow's phenomena and the Hermit's sign. Okay, so I will be explaining this now. Uchtow's phenomena means it is a worsening of the symptoms of multiple sclerosis due to exposure to higher than usual temperatures. Okay, exposure to higher than usual temperatures. It can be over the temperature or very low temperature. So the option number B, like yoga in a cool room, then another option like sunbathing, everything can be omitted with the help of this phenomena, that is the Uchtow's phenomena, where there will be worsening of the symptoms of multiple sclerosis due to the exposure to higher than usual temperatures. Then what is a Hermit's sign? So Hermit's sign means it is an electrical sensation that runs down the back when bending the neck. Okay, so while bending the neck, which are particularly characteristics of multiple sclerosis. Okay, so there will be an electrical sensation that runs around the back when the neck is bent. That is known as a Hermit's sign. So the other exercises like yoga and that cross country running and all should be avoided in patients. It can aggravate the symptoms of multiple sclerosis. So relaxing in a warm bubble bath is the best option what we can choose for a patient for relieving the stress of the patient. Okay, so Uchthoff's phenomena and the Hermit's sign, very important. Now we will move on to the 16th question in the series. So the question is, dash is planned or emergency temporary care provided to caregivers of a child or adult. Okay, so this is a very simple question. With the help of options you can easily find out the answer for this question, but I prefer this question to understand you about that particular term. Okay, so dash is planned or emergency temporary care. Emergency temporary care provided to the caregivers of a child or adult. For the caregivers, not for the patient. Okay, so the options are, first one is the palliative care, option number B is the curative care, option number C is the respite care, and option number D is the preventive care. So here the only confusion is between the option number C and D, that is the respite or the preventive. But what is the answer? The other two options are not the answer that I know, that you know. So the option number C, that is a respite care, is the answer for the question. So respite, we will see the other options also. Before that, respite means it is a planned or emergency temporary care which are giving to the patient parties of a patient. Okay, so what is a palliative care? That you know that it is an interdisciplinary medical caregiving approach which is aimed to optimizing the quality of the life and mitigating suffering from people with serious, complex and often terminal illness. Okay, palliative care, the important key term is terminal illness. Then what about the curative care or the curative medicine? It is the health care given for the medical conditions where a cure is considered achievable or even possibly so, and directed to this end. Okay, and what is a preventive health care, otherwise known as the prophylaxis? It consists of the measures which are taken for the purposes of disease prevention, as the name indicates. Then respite care already I have explained. Okay, so that's all regarding that question. So respite care, that is a term that you are learning in this from this question. So moving into the 17th question, which is a GK, and the question is, where is the headquarter of United Nations Environment Program located? So United Nations Environment Program, otherwise known as a UNEP, where is the headquarters? And the options for you are option number A, Switzerland, option number B, New Zealand, option number C, Kenya, and option number D, India. So where the headquarters of United Nations Environment Program located? So the answer for this question is Kenya. Okay, so we know that Nairobi in Kenya, where there is the headquarters of this United Nations Environment Program, and it is established in 5th June 1972. Okay, so moving on to the next question in the series, that is the 18th question, and the question is, the nurse is caring for a 4-year-old patient with a diagnosis of cystic fibrosis. So here the patient is diagnosed with cystic fibrosis. So the child is feeling better on the 3rd day of the hospitalization and wants to play. So in this situation, what would be the best choice of entertainment? So it's an application level question. So the key points in this question are the child. Here the child is 4-year-old and the patient is having cystic fibrosis, and patient is better now and wants to play. Then what will be the best choice of entertainment? And the options for you are option number A, blowing bubbles, option number B, looking at picture books, option number C, watching videos, and option number D, riding in a wagon. So in this, some options it can be given for a patient with cystic fibrosis, but what will be benefited for the patient, for the child, if you are among these options, what will be benefited for the child? That we have to find out. So the answer is option number A, that is blowing bubbles. Why? What effect the patient's lung will be getting off while blowing the bubbles? That we will see in the options. So cystic fibrosis, what is a cystic fibrosis? It is a rare genetic disorder that affects mostly the lungs. Okay, and along with that it can also affect pancreas, liver, kidneys and intestine. Okay, so the long-term issues which include difficulty breathing and coughing, and expectorating up the mucus as a result of the frequent lung infections. Okay, so here the child is more susceptible to get infections, and there will be issues with breathing and coughing. Okay, so that is just a small note about the cystic fibrosis. And in cystic fibrosis, the main aim of the physiotherapy is to prevent the secondary complications and improve the quality of life by removing the excess mucus secretion. Okay, so I told that the mucus secretions will not be expectorated out. So the physiotherapy should aim at removing these excess mucus secretions and maintain and improve the lung function and assist with the musculoskeletal therapy where needed. Okay, so this is the aim of physiotherapy. Then regarding our question, bubbling, okay, that was the best for this patient. Why? So there is a technique called positive expiratory pressure, otherwise known as the PEP, positive expiratory pressure. So it is a technique that helps to open up airways and get air behind the secretions to help move them higher up in the airway. Okay, so while doing this bubble PEP, it is used in the young children and it involves the child blowing through a straw placed in a bottle of water and soap to produce the bubbles. So by doing this, the air will be trapped behind the secretions and it will help the secretions to move up in the airway, and from there it can be expectorated out. Okay, so that's why bubble PEP exercises can be advised for a young children with cystic fibrosis. Okay, so and that will be entertaining also. Okay, so I think that question was very informative for you. Now we will move on to the second last question in our series, and the question is from the dermatology, and the question is, which among the following is a non-cancerous skin lesion that originates from the cells in the outer layer of the skin, appears like light tan or black, which advances with age? So there are so many very important key points in this question. First of all, it is a non-cancerous skin lesion and it is originating in the outer layers of the skin, and it has a light tan to black color, and it is advancing with age. So there are 4 important key terms in this question to answer the question, and the options for you are: first one is seborrheic keratosis, option number C is actinic keratosis, option number C eczematous dermatitis, and option number D lupus erythematosus. So just think about the 4 key points what we have given in the question: non-cancerous, outer layer, light tan or black appearance, advances with age. So these all characteristics can be seen in option number A, that is a seborrheic keratosis. Okay, so what is seborrheic keratosis? The other names are seborrheic verruca, okay, or basal cell papilloma, because it can be associated with the papillomas, and senile wart. Why senile wart? It is already explained in the question that the patients, it get advanced with increasing age, so that's not otherwise known as the senile wart. Okay, so I think it is clear about the seborrheic keratitis. So we will see the other options. Another option was actinic keratosis, or it is sometimes called as the solar keratosis or senile keratosis. Okay, solar. So from the name itself, you can identify. So it is a precancerous area of thick, scaly or crusty skin, and actinic keratosis is a disorder of the epidermal keratinocytes that is induced by the ultraviolet light exposure. Okay, so that is actinic keratosis. Okay, so here the lesions are very thick and scaly, and crusty skin will be there. Okay, so these are not characteristics of the seborrheic keratosis. Okay, so next was the dermatitis, otherwise known as the eczema. Already we have explained in the other videos. It is an inflammation of the skin typically characterized by itching, redness and a rash. And lupus erythematosus means it is a collection of autoimmune diseases which can affect many different body systems, including the joints, skin, kidneys, blood cells, heart and lungs. And the most commonest and the most severe form is SLE, that is systemic lupus erythematosus. So where we can see a butterfly shaped rashes can be seen. Okay, so with this question you are getting clear cut differentiation between the seborrheic keratosis, actinic keratosis, eczema and lupus erythematosus. Okay, so moving on to the very last question in our series, and this is from the general knowledge, very important question. Freedom of speech and expression is mentioned in which article of the Indian Constitution? Okay, freedom of speech and expression is mentioned in which article of the Indian Constitution? And the options for you are: option number A, article 34, option number B, article 21, option number C, article 19, and option number D, article 31. So what is the answer for this question? Freedom of speech and expression. So the answer is option number C, that is article number 19. Okay, so article number 19 given the freedom of speech and expression. Okay, so with that informative question, we are coming to the end of this session. So we have discussed almost 15 questions from the nursing subjects and 5 questions from the GK. So all more than these questions, as I told in the beginning, these options are very, very important, and the explanation also is very, very important, because we don't know from which areas questions can come. So once again, wishing you all the very best for the upcoming exam, and we will be coming with the next video very shortly. So till that time, stay tuned and study well. Thank you for watching the video.